Apron and gloves should be worn as PPE whenever undertaking a task where there is risk of bodily fluid contact, and routinely when caring for those under standard, droplet or respiratory isolation precautions. The hands and front of uniform of healthcare workers will have the most contact with the patient and the care environment, so will become the most heavily contaminated. It is therefore really important to both apply and remove your apron and gloves correctly and at the right time. Applying a disposable apron. Remove the apron from the wall-mounted dispenser. Avoid keeping rolls of aprons laying out and exposed in the clinical area. They can become contaminated, and removing one from a roll requires more handling. Open the apron out fully, inspecting for any tears or rips. If the apron has torn on removal from the dispenser, discard it and take another. Place the apron over your head and wrap it around your body, tying the straps comfortably at the back. The aim is to cover as much of your uniform as possible. Select a pair of gloves from the dispenser. Again, avoid keeping open boxes of gloves laying around the clinical area. Encourage people to take them from the dispenser and keep the dispensers well stocked. Choose the best size fit for you. If gloves are too large, they can fall down around your wrist and potentially off your hand. If they are too small, they can inhibit your hand movement and potentially tear while in use. Complete the task that you applied the apron and gloves to do. It's really important you don't wear PPE for longer than completion of the task you put them on to do. If you move on to other tasks without removing them, you risk cross-contamination of environmental surfaces and cross-infection of other patients or colleagues. Wearing gloves means hand hygiene cannot be performed, and hand hygiene remains the single most effective way of stopping cross-infection. Removing your apron and gloves. Stand close to a foot-operated clinical waste bin and clinical hand wash basin. For gloves, remove your gloves first, as these will be the most heavily contaminated item. Grasp the exterior cuff of one glove with your other gloved hand. Pull this glove off, aiming not to touch the skin on the hand of the glove being removed. Drop the glove into the clinical waste bin or ball it up in your remaining gloved hand. Take the index and middle fingers of your ungloved hand and slide them under the cuff of the remaining glove. Slide this glove carefully off your hand, aiming not to touch the contaminated outside. To remove your apron, lift both hands up to the back of your neck in order to pull the apron neck strap apart. Allow the bib of the apron to gently fall down on top of the apron skirt. Take both hands around your back in order to pull apart the waist strap of the apron. Carefully and gently roll the apron in on itself in order to contain the straps without touching the front, which will be heavily contaminated, and drop it gently straight into the foot-operated clinical waste bin. Make sure no parts of the discarded apron are hanging outside the waste bin. Wash your hands with water and soap. If you are continuing with a session of care, you are now ready to continue with your clinical duties. If this is the end of your session of care, then you will also need to remove and replace your surgical mask as you leave the clinical area. Reapply a fresh surgical face mask.